Good afternoon, good morning, good evening. I'm delighted to be here. My name is Joan Lombardi, and I have the honor of co-moderating this very important webinar. I want to welcome all of you from around the world to a webinar that's focused on the early childhood workforce in times of COVID-19. We have many questions today, but the main one is the workforce adequately supported? The webinar is co-hosted by the International Step-by-Step Association and Results for Development. As a team, they lead the Early Childhood Workforce Initiative. Before we get started, I also want to thank our partners, the Africa Early Childhood Network and the Early Childhood Development Action Network for their amazing work to keep everyone informed along the way. I want to recognize all the early childhood networks and organizations around the world, from the Middle East to the Asia region to countries throughout Latin America and the Caribbean. You are all heroes as you stand up for children's families and those who care for them. During the webinar, we'll have a panel, we'll have time for Q&A, and you should make sure we put the questions in the chat box along the way. And we'll also have some polling so we can hear directly from you. We're very grateful to our panelists, Cecil Havra from Norway and Grace Matape from South Africa, for taking the time to share with us today. We had hoped to have a representative from Brazil, but due to the very serious circumstances there that's taking place right now, she was not able to join us. Our hearts go out to all of you around the world who continue to face this terrible crisis. I want to remind people that this will be recorded. And now I want to turn it over to my co-moderator, Mihaela Enescu, who's the program director for ISA. Mihaela.
Hello, Joan, and welcome everybody also on my behalf, on ISA's and Results for Development behalf. And we are going to invite all participants to bear with us in switching from the webinar platform to other platforms so that we can address a few questions to you and share some of your thoughts, which would mean that you would need to move to the browser of the internet and introduce this address, www.menti.com, so that we know who are the participants in our webinar. And you will have to use this code. The moment that you will put menti.com, they will definitely ask you for a code. And that's where you will have to answer to this question. Choose one of the following options that reflects best your professional position. We're going to wait for you. Don't worry, there is time. I know that it's a bit challenging to switch from one place to another. If you're on your phone, you can do it on the computer. If you are on the computer, you will have to press escape to get out from the full screen mode and go to the browser. The code is 794422. And here, we're starting having our colleagues participating. Don't worry, we are going to wait for you. So we have the options: practitioner, manager of early childhood service, training provider, policymaker, researcher, higher education staff, management or program staff working in civil society organizations, donor organizations, and other options. It seems that the largest group of colleagues are representing management and program staff in the civil society organizations and donors, and followed by others and managers of early childhood services. We still hope that we will get at least one participant, a policymaker. Yes, we have it. So we can summarize that the portrait of the audience today has, let's say, strongest traits around management and program staff for organizations that are working in the civil society sector and donor organization. Lots of managers of early childhood services, researchers, higher education staff, practitioners, training providers, and policymakers. They're the lowest number of participants, but maybe they will join us later on. We'll move to the next poll, as we would like to know with what category of the early childhood workforce you work mostly. I can see that you're doing better in voting this time. Well, it's a majority of participants that are working primarily with the early childhood education workforce. We have quite a proportion of those working with health workforce, and we got to 54 participants voting for now. I can't see the full screen. I don't know the total number of the participants for the moment, as I know that not everybody managed to join from the very beginning, but I think that we have almost half of them working with early childhood workforce. The other sectors are quite evenly distributed, as we can see. We're going to wait for a few more seconds. And it seems that the graph does not change dramatically. So we do have a dominance of those working with the early childhood education workforce, yes. And the others are kind of evenly distributed among health, social protection, and child protection. And there is also the category others, which has almost, has an equal distribution with the other ones. Well, I think it's important that we have all the major categories of workforce represented, as I think it's very important that we capture this cross-sectoral representation, as we all need to come together to find ways to protect the early childhood workforce being low paid, low recognized, which does not match at all with the essential nature of the work that they are doing on a daily basis. And it's great that we have now such a wide representation in our participants today. Joan, I'm going to hand it over to you.
Great. Well, thank you. It's good to see the diversity of the roles and the diversity of the sectors that you're working in. I would add that you're all policymakers because your voice is important in the policy process. So we're going to get started. I think the world, unfortunately, has turned upside down over the past few months, and we all remain deeply concerned with the impact the crisis is having on children and families, from the dramatic impact on health and nutrition, the concern for their safety and security, and the disruption of early learning, and the difficulties that families are having responding to it all. These are all the factors that are key elements in nurturing care, and assuring them in this very difficult period must remain our goal. To do this, we're really relying on a committed workforce that needs support themselves. The challenge in talking about the workforce is that every aspect of the landscape is different depending on the context. For example, the workforce varies depending on the types of programs and services, the sectors you're in, what we call them, from preschool to childcare to home visiting to child protection, how they're financed around the world. We know there's a continuum from public pay to private pay, and the mixture and combination of financing strategies in any given country. We know the roles are different. And on top of that complexity, the pandemic has hit countries in different waves. Some have been in lockdown for many weeks, others are still in lockdown, and others are opening up or have been open the entire time. So whatever the context, we all know it's the people who work directly with children and families who are essential. They're the heroes. They deserve to be protected and supported, yet the response varies around the world. While we hear a lot about schools closed, we hear less about childcare and other early childhood programs. Even in the best of circumstances, there are issues. What their work will look like in the future, how they're feeling now, how do we feel about wearing masks with children, what will happen if programs close. The list goes on and on. So we're going to focus on two main questions today and then take your questions again in the chat box. The first question we're really concerned with is what measures have been taken in countries to protect and support the workforce? And secondly, what plans are in place for the reopening of childcare and education services? So to start that conversation, I want to turn to our first panelist, Cecil Havre. For the past 8 years, she's worked as the senior advisor in the Union of Education in Norway, Norway's largest union for educators. I know, Cecil, you've worked mainly at the national level on policies. You, like me, started as a teacher in your earlier years. Tell us something about the situation in Norway.
Thank you so much for your introduction, Joan, and I'm very delighted to be here together with you with this very important team. So, most recently, I have worked within the union with the reopening of kindergartens in Norway, and I have been in a close dialogue with our union representatives at all levels about the experiences being done in the kindergartens. And every week I get reports from all over the country about the experiences and challenges. I will start with sharing a little about the context of early childhood education and care in, or kindergarten as we call it in Norway, and that you can read here in the picture. I think because we don't have that much time, I think you just need to read it there, and we then go straight to the next picture about the close down of kindergartens. So, Corona hit Norway the last week of February with increasing numbers of infected day by day. And the health authorities and the government were in collaboration deciding how to deal with the crisis. And on 12th of March, Norway decided that from the day after, the 13th of March, there should be a national close down of schools, kindergartens, and also higher education, and also for personal services like hairdressers, gyms, and alike. People were recommended to stay at home and work from home and to not use public transport. We were told to keep distance to each other and to not be in groups of more than 5 persons. It was a kind of shock. And the strict measures that were introduced led to people really realizing the seriousness of the situation and actually being in crisis. The close down of kindergartens was for everybody, but with some important exceptions. Essential workers and children with special educational needs should still have the service of kindergartens. Kindergartens leadership and staff was, as the close down proceeded, needed to think about how to communicate with parents, but also how they could connect with the children. The National Parent Committee made a survey about the consequences for families, and in the diagram at the picture, you can see results showing what contact kindergartens have had with parents during the close down. So what the staff actually did during the close down in Norway was to organize an offer for the children that was decided still to have an offer. And these were very few children. In some kindergartens, it was maybe 1 or 2 children. And also they were doing cleaning and tidy up. This was mostly during the first week of the close down. It was about information and reach out to parents, give activities for children and parents staying at home. And most staff worked from home with cooperation with each other and with professional development, which is usually not enough time for. So this was very much appreciated. Leaders kept in touch and provided tasks to all the staff. And a few employers were relocated to other tasks in the municipalities, like answering on the phone or working at the nursing home. A study from Oslo Metropolitan University shows that many of the staff were very afraid to go to work during this time. But I think the most important measure taken by the authorities during the close down was no doubt to sustain the public funding at the same level and to compensate the parental fee to all kindergartens, both the public and the private. And on one condition, staff were not laid off. And because of this, no kindergarten staff in Norway were laid off. And this has been really important for the staff. So then we go to the next picture and the reopening of the kindergartens. The stringent measures worked, and the number of infected decreased in the beginning of April, and the government decided to take cautious and controlled steps towards reopening, and kindergartens would open as the first one from the 20th of April. So of course this also made the staff in the kindergartens be a bit afraid, because everything was still closed down, and the kindergartens was the first to open, before the hairdressers, before the schools, before everything. But guiding principles for the reopening was developed, and the infection measures that kindergartens must implement is that children and staff should stay home when they are sick, even with mild symptoms, cleaning hands and toys, supplies, furniture, etc. several times during the day, and to reduce contact, that the children should stay in permanent small groups. For the kindergarten leaders and staff, it meant they had to organize in new ways. Where they previously could collaborate across the opening hours and have smaller and bigger groups throughout the day, now the small group structure meant that they were less flexible and made it difficult in practice, since the children stays in the kindergarten longer than the staff's working hour. We managed to gain understanding from the national government that kindergarten will have to limit the opening hours to meet the requirement in the guidelines. So most kindergartens have had openings hours between 6 and 9 hours. Many kindergartens operate with different openings hours depending on the parents' needs. And we have during this time received a lot of feedback that it has been demanding for staff to live up to the requirement for small groups, where the staff have to be together with the same group of children all day long, together with increased cleaning and hygiene. Many kindergarten teachers have not been given time for reflection, planning, and many also report that they do not manage to take a break during the day. And then we turn to the next picture, please. There is a pressure to increase opening hours as society is opening more and more. The need for flexibility for parents and the working life seems to be high on the agenda in the public debate, and the role of kindergarten as an educational institution comes in the background. Anyway, as long as the kindergartens are supposed to perform various additional measures to limit infection, they are clear about the need for limiting openings hours from what is the normal 10 hours. This is both what we get reported every week from our representatives and also what the center leaders have answered in our members' survey for leaders, as you can see in the picture here. So then we move to the last picture about now that the kindergartens are open again, what are the most important measures that is taken. And then I will highlight the importance of cooperation with representatives for the unions at both a local and a national level. This is so important to gain trust and to make the measures best adapted to the kindergartens. Those who work there is those who know best what works and what doesn't work. So to give you some examples of how we have done this in Norway, it has been regular meetings between the union leader and the Minister of Education. And in these meetings, they have discussed the next steps and how we should do it, how is the best way to open the kindergartens and which measures are necessary to take. And as an example, we were very clear that we needed time to prepare for opening. So we was also given time. We were actually told before Easter that the kindergarten would open from the 20th of April. So we would have time to organize it. And this is really important. And we have also been given the opportunity to give input on the guidance that has been created so that it could suit for the kindergarten. And the regulations that has been made to make it possible to reduce the openings hour is also very important. And of course that they have made this guidance, especially for the ECE sector, it's very important. And also that the staff has the possibility for testing. Earlier, this was really difficult. But now, after the opening of the kindergartens, the staff is prioritized to get a test if they have symptoms. And also from our side in the union, we do our best to support the staff by, of course, being their voice into the governments and also in cooperation with the employers and other organizations. But also, there is a lot of need. There's a lot of needs for information, and there's a lot of questions. So we have also made question and answer on our websites. And I think also it's important to highlight the very special situation that our leaders are in this situation, both during the close down, but also during the opening. There's a lot of pressure on them. So it's very important to support them. So about the situation right now, there is very little contagion in Norway, and we are opening more and more of the society. We are actually returning to a more normal life in Norway. And yesterday, the Minister of Education published that we will have received guidelines this Friday, tomorrow. And this new guidance will provide measures that are divided in 3 levels, according to the infection situation. And it is the local infection control authorities that will decide which level should apply in their municipality. It will be like a traffic light with the red light, the yellow light, and a green light. And right now, the measures in the kindergartens are like red light. And we think that most of the kindergartens will be able to, from within the next weeks, turn to a yellow light. And that will maybe make it more easy to have a more normal opening hours also for the kindergartens. So I think this is what I will say now. Thank you.
Well, Cecil, that was amazing. And it is so heartening to hear that there was compensation available for the teachers during this period. I know there's a lot of questions coming in. I hope that you do share the guidance that comes out tomorrow, because I think a lot of the listeners will be interested. You know, despite all those really important steps forward that you've taken in Norway, what would you say is your greatest challenge?
Well, I think a big challenge has been that it hasn't always been clear, you know, how to read this guidance. And like, I think for the staff in the kindergartens, they have been very eager to do everything they can, you know, so they are okay. We do it like that. They read them like line by line, and they do everything that stands there. And I think that maybe some owners and others would say that you don't have to do it that strict, you know, you can be more flexible about it. So there has been a lot of debates. So I think it's very important for the staff to know how to handle this, because of course they are frightened. And even if it's a very good situation in Norway now, we don't know how this will develop, and maybe it will, you know, the infection will increase again. So we don't know. So we have to be prepared for everything. So I think to be clear about what is expected is very important.
Yes, well, and I'm sure we'll come back with more questions. Just a reminder to those listening, please put your questions in the chat box and we'll turn to you after our next speaker. I want to thank Cecil for your leadership and your example of how to support the workforce, but still challenges remain, and they'll continue to remain as things change. So thanks, Cecil. We'll come back to you with some questions. I'm going to turn now to Grace Matape, who's the CEO of Smart Start South Africa, a wonderful colleague and friend. Smart Start is a new social franchise for early learning. She was the past CEO of Love of Life, comprehensive HIV prevention program that's targeted young people. She's had extensive background in mental health in government and nonprofit. So we are really honored to have you with us here today, Grace. Tell us a little bit about the situation and how things are changing. I know South Africa, like where I live, things are changing day to day. So welcome.
Thank you very much, Joan, and good afternoon, everyone. It is such a great pleasure to be here. And listening to Cecil, it really is such a stark contrast to the situation here in South Africa. And so in order to talk about the impact of the COVID-19 epidemic on the ECD workforce and whether or not we supported them well, I have to first start by sharing the context of the ECD landscape in South Africa. If you can go to the next slide, please. So in South Africa, more than 3.3 million of South Africa's 0 to 5-year-old children still do not have access to any form of early learning program. So these are children that are at home, are understimulated, and a big challenge is that almost 90% of these children come from the poorest communities. There's approximately 700,000 of these children who access programs that are registered and subsidized by government. The ECD provision in South Africa, as most of you know, is largely a private provision with a subsidy from government that covers part of the cost. So it really is a situation of a partnership between the parents and the government as payers of the service. And the workforce is right in the middle. But this situation means that there are about 1.5 million children who are accessing early childhood care and education programs in South Africa without any benefit from government subsidy. Obviously, it's a major concern, as what it does is perpetuate that poorest children are excluded because of the compliance regimen that is really hard for some of the disadvantaged communities to meet. So we have a situation of about 50% of children, as you see in this graph, who will start school without the benefit of a strong foundation in learning and education. And so please, if you can move to the next slide. This just puts a little bit of context to SmartStart, the organization of which I am a chief executive officer. We were established in order to build a delivery platform that will enable rapid scale-up of access to early childhood education for all children, focusing really on the poorest children, making sure that they have a fighting chance to succeed in life. If you could please click. Thank you. The SmartStart program was designed as an early learning social franchise. What that does is, SmartStart itself is not a service provider, but what it does is recruit women and men in low-resource communities. We screen them, we train them, we license and support them through our network of coaches to implement the same evidence-based program, which we call the SmartStart routine. And we support them with resources and play materials, quality assurance processes, network. All of this is not to replace the well-established, solid ECD provision that is happening in South Africa. What we are trying to do is to close the gap of access. All of this as context is really important in order to understand how we were hit by the COVID-19 pandemic and its impact on the ECD sector as a whole. If you could move to the next slide, please. Next slide, Emily. So, I've described the access from a child's point of view. The exact data of the size of the ECD workforce in South Africa is not available because there is such a big proportion of the population that is served by unregistered centers, that data of which is not known to us. But according to some of the sources of data in South Africa, in 2016, there were 46,571 ECD practitioners nationally in South Africa. 60% of them were in registered ECD centers. And if you remember the data I was talking about, that means they are serving 10% of children. Our recent modeling looking at what is required in order to close the gap of access. It shows that we will need 107,000 new practitioners and assistants in order to meet the provisioning gap at the right ratio for children in South Africa. Next slide, please. So I was just trying to paint the picture of the vulnerability of this, or the varying levels of vulnerability of this sector to the epidemic when it hit us. COVID-19 rapidly entered the ECD space as a significant disruptor. We did in partnership with a few large associations and networks of ECD providers in South Africa. We did a rapid assessment of how the COVID-19 was impacting the sector. What was amazing is that we had a sample of more than 8,000 respondents within just a couple of, just under 10 days. And the results are alarming to us and many people who are concerned in South Africa. 83% of ECD operators reported that they had not been able to pay full salaries. 99% of the parents were not paying fees, which I suppose was expected, considering that the entire, a big chunk of the responsibility for funding of ECD provision comes from parents. If parents don't pay fees, it means that the operators of ECD provision will not be able to pay fees, salaries either. 68% were worried that they would not be able to reopen, which is truly alarming to us because our big aim is to close the gap of access. And so if there are providers within the ECD provision whose existence is at risk of closure, it really is a big concern to all of us. 35% of the ECD workforce in the survey are registered with the Unemployment Insurance Fund, which means they would be able, if they are not paid, would be able to draw from the Unemployment Insurance Fund. 13% of the ECD providers are registered with the Registrar of Companies, the Companies Intellectual Property Commission. And so what this indicates, what these two, the UIF and the CIPC issues, they indicate that means a very large proportion of ECD operating the informal economy. They are not registered as companies and they do not contribute to UIF. The major concerns that came out of that study and subsequent interaction with the workforce is concern about food insecurity for the poorest children, as well as the informal economy practitioners. There were also concerns about stimulation of children at home. There are many initiatives in South Africa, including by Smart Start, but many others, other organizations that are doing really good work to get stimulation content to children using zero-rated websites, using SMSs, WhatsApps, some form of engagement with both practitioners and parents to suggest activities that will continue to stimulate children at home. There's also major concerns about child safety, both during lockdown as well as when the economic activity has begun. And South Africa has adopted a risk level based approach to lifting of lockdown. So in level 4, which is where we are now, some economic activity started to happen. Unfortunately, though, ECD centers are not open yet, putting children at real risk of a compromised childcare activities. And so, as we think about reopening, because there's been a lot of conversation in South Africa about reopening of schools, but now there is growing momentum around thinking of reopening of ECD provision. We have to think about a few contextual realities. The first one I've implied is the very diverse context that we're working in. And so this really is an opportunity for an inclusive process that when we think about reopening, which is what we are doing and hoping that it will happen soon, that it should be including both registered and unregistered centers. The profile I was painting for you just now was just to show you what the proportion of children are that are in unregistered centers where the risk and vulnerability is already so high. Another contextual reality is that there's going to be high unemployment post-lockdown. And this was estimated in the news yesterday at about 40%, which is unimaginable. And so it's going to impact the ECD sector if parents will be struggling to pay fees, and that there'll be impact on the materials that they're able to procure, even ability to access PPE to protect both themselves and the children. We also think that another contextual reality also just coming from that rapid assessment we did is that there'll be high workforce attrition with resulting implications of a need to do big recruitment drives and retraining, all of that putting pressure on the network of ECD providers, really who are doing most of the training function that is going on in the ECD sector. And we're just really concerned about the increase in the cost of provision as well as the impact on quality. What is going to be essential is that we have to support ECD operators towards sustainable ECD enterprises. What the pandemic has shown, Joe, is that the vulnerability we have felt by the big chunk of the provision being in the informal sector, it's what needs to be strengthened, just to because this is exactly the kind of thing that concerns about us about to what extent will this provision be available post lockdown, and how far South Africa has got to go back to start rebuilding an ECD provision for South Africa. So if the question is, are the ECD providers well supported? The answer has to be in South Africa, not really. They really are bearing the brunt of the COVID-19 pandemic, and both economically as well as health risk-wise.
Well, Grace, thank you. I think we're all very moved by the situation there. It's reflected in other countries. It's reflected in my own country. So I want to thank you, and I think the rapid survey you did, I think it's going to be of great interest to the people around the world. So if you could make that report available, we'll get it distributed. You've been a role model of taking action in the midst of the pandemic. You mentioned opening. Does the government have plans for reopening, and what protocols are they planning to put in place?
Yes, so currently there is discussions between civil society and all ECD role players and government on reopening protocols. And there have been some suggestions that have been put in place. We've just identified that what will be essential is that there be clear guidance relating to physical distancing and hygiene measures, that, it's inevitable that some of the sites might not be suitable post-lockdown, really, when you test them against the risk of infection. And so we just need a mechanism of supporting the sites to make them safe at reopening. Guidelines of self-checking mechanisms as the providers reopen. Remember, these are not government employees. They are all private providers. So you cannot force them to reopen. You can just allow them that they can reopen. And so there's going to be quite a lot of work to be done and put in place, also to make sure that it isn't only a section of ECD that is allowed to operate, but that we look at all of the diverse contexts, because in all of those situations, there are children that need care and stimulation.
Well, and that's the bottom line. I'd ask Cecil to join us because I'll open it up to questions. I'll turn to Mihaela to talk a little bit about the questions that are coming in the chat box, and ask Cecil to join us in responding to those. But I do want to reflect on the fragility of the system, wherever you are. It was fragile before the pandemic, and this is going to have an overwhelming impact on the workforce, on children and families. So, Mihaela, let's turn to some of the questions that are coming in.
Yes, Joan, I hope you can hear me.
Yes.
There is, I mean, in the context of the reopening, there was one question related to what extent there were parents that actually decided not to send their children to the centers, and if there is any percentage about that, especially for Sissel, given that she provided a lot of information of how the centers have started reopening. But I think it's a general issue. Even if services operated, if parents were willing to send their children to the centers.
Yes, in Norway, this it has been parents have been worried about sending their children to the kindergartens, and especially during the first week. And as I told, because kindergarten was the first thing to open, so there was very few children actually during the first week. But it was from the governments. It was were telling again and again that this is really safe, and also we did that. Like, okay, we have to trust that when when the health authorities says that this is safe, that there is not that much infection spread between children, we have to listen to them. But still, there is still not all parents having the children in the kindergartens. So this is actually not a big problem, but in some parts of Oslo, the biggest capital in Norway, it was, at least last week, it was in some parts of Oslo, it was about 30% of the parents did not leave their children in the kindergarten. So that is a bit challenge, but this is it's more and more children are attending. So I think this will, now that we are going back to normal and everything, you can go to the restaurant again, you can go to the hairdresser, people are starting to go more to work. I think it will solve the problem. But I think also still some parents that are working from home and have the possibility to have the children at home, maybe they are laid off and don't have a work right now. Some of them will prioritize to just have the child at home. So
I don't know if Grace wants to add anything to this issue, or
well, in our situation, there hasn't been any reopening yet. ECD is not functioning, and so and engagement with parents is something that we can do proactively, learning from situations like the Norway situation, really bringing them on board as part of the partnership as we think about what mechanisms to put in place.
Yeah, I was curious about the relationship between education and health and how they're working together.
in Norway, yes, they have been very closely collaborating at a national level, and I think also it's been a little more different at a local level. But that is something that we also have highlighted all the way, that it is so important that also at a local level, that we have this cooperation between the health authorities and the pedagogical governments, because I think it's very important that not the staff in the kindergartens are the ones who are going to decide how to do this, because they don't have that competence. So we need and not take the responsibility about what is good enough and what is not good enough. So this cooperation is also something that we have highlighted that is very important, and I think at a national level this has been very good, even if you can hear that they sometimes not always agree on everything.
Yes, I will have a more specific question addressed to Grace. With the already limited support from government towards the registered ECDs in South Africa, is there any further analysis on the impact of these non-supported, unregistered ECD centers not being able to open due to financial difficulties and not being able to meet the COVID safety measures? I think it's a very good question, because that perhaps will weigh a lot in the policy making and in the decisions making.
Yes.
Yeah.
Yes. So I'm not aware. I actually think that there are a few other analyses that are going on. I mean, assessments that are going on, some rapid surveys, some better understanding, and so on. But if you look at the rapid study that we did, and you see the proportion of people who are in the informal market. That already gives us a good source of data to analyze further, I suppose. And there hasn't yet been that analysis done. But if we look at the 83% of people who are not registered with the company's registrar, we can do further analysis and hopefully develop specific recommendations for the support of that sector, the government. You know, right now we feel like it's a good opportunity because we all agree on it's important to limit COVID-19 infections in South Africa. We all agree that it is important to limit job losses in South Africa. We all agree that the ECD provision is an essential provision. And so I think that we could really take advantage of this opportunity to come more together in shaping a better future. But that data does not yet exist for us.
Actually, I like very much what you said now at the very end. I was wondering, Grace, if it's the same perception also in Norway about seeing the early childhood services as being essential services, because that really impacts a lot also in the way that the funding and the prioritizing is happening.
Yes, it's also seen as an essential to the society. So I think that has been important. But as I also mentioned, I think it's very much about parents be able to go to work, and of course it's important for a society because people need to go to work to have the wheels going around, and because of the economic situation. But it's also about that this is an educational institution, and that is something that I think has been too much in the background. But of course it's this essential work that we are doing in the kindergarten, and that's also why, like now with the opening of the kindergartens, when we have had to limit the opening hours, it's been like if you are an essential worker, you will you can have a longer time for your child in the kindergarten, and that is also for the staff in the kindergartens because you are essential workers. So you will have you will have more times for your child in the kindergarten, so you can go to work in the kindergarten.
So
and of course,
the school closing and the kindergartens closing were the same.
Yes, they closed at the same time, but the kindergartens was opening first because it's the most important, because parents have to go to work. So it was first the kindergarten, and then it was the first to fourth grade at school, and then it was and then the other came later from the fifth grades and so on. Yes.
That's
Can I just say something? So when I was saying essential service, I was using an English word. I wasn't talking about the label of essential services in the context of the pandemic. Unfortunately, that is what we failed to do. We did not identify ECD as an essential service. So in fact, we had essential service workers going to work and ECDs not allowed to be open. It's exact opposite of what is going on in Europe. Yeah. Mm-hmm.
And I think around the world you'll see a variation of both.
Yeah.
And I think again, the financing structure prior to the pandemic affects what's happening now. And right.
Yeah.
May I have other questions from the chat box?
Yes, I mean, there are many questions coming in, I have to say, and I can't make justice to all of them, unfortunately. But there are some that are referring to the health and protection of the workforce, especially during the reopening. If this is something that the government is looking into, or is something that it's the responsibility of the managers of the service, how much guidance is provided for that? And also about wearing masks, I mean, within the social distancing in the early childhood services. I mean, this is something that is still a bit of a concern, how to keep this tension in between, health protection, but also not damaging the relationship, the quality of the interactions and everything around that. So this is another, I grouped a little bit the questions under, bigger header.
Grace, any comments? And then I'll turn to Cecil on that.
Yeah, so I actually am quite curious to hear what your advice for us would be, Cecil, because we are a country that is right now negotiating exactly those guidelines with our government and civil society organization. And it would really be useful to hear from you. I mean, what is your advice to us as we think about this process?
Yes, I think it is very important that it's not a very big difference about what is the recommendation for the country as a whole. Like in the start in Norway, when you had this stay at home, don't go to the shop to shop food if you don't have to. If you are there, if you touch something, you have to buy it. Don't put it back. And then they're going to reopen the kindergarten, and it's like we know that for small children we have to be close with them. You can't keep in distance. So this was a big issue, and it was debated a lot. And also that was also our input to this guidance, that it cannot be very big differences. It can't be like, okay, you can go to work and you can be together with 20, 30 children, but when you go home you have to keep in distance to all persons. So this was very important, I think. And that's why we also had in this guidelines that we have now, that there's going to be small groups. And it was like we have this requirement in the law for how many children it can be per staff. So it was like for one staff you should have 3 children if the age is under 3, and if you have children more than 3 years old, it will be 6 children for one staff. And then it was supposed that within this group you could be like a family, you could be close to the children and do everything you have to do, but you should not have these groups to interfere with each other. So that's why it was quite demanding, for the staff to keep, apart, and like, this is my group and we're not together, but also they could cooperate a little. So this was, if you had to go to the toilet, maybe I had to ask, can you watch my group while I'm, but please try not to touch them if you don't have to. Of course, if something happens, you might have to do it. But this was something that was done. But we have never wear mask in Norway. We don't have that. We don't have these protections requirement for the staff. So we just use our own clothes and are staying there. But to the other staff, we have to keep in distance. So I think when we have this new guidelines for tomorrow, I'm not quite sure what will be there, but I think it will still be that we should keep in distance from the other staff. We have to be close with the children, but we have to keep in distance when it's possible to the other adults. So,
what's your reaction to that, Grace? I'm curious.
In South Africa, I'm just thinking about what you're saying. In South Africa, masks are part of our regulations. So when you are out in public, everyone is required to wear a mask. And we've just been wondering what it looks like for a 3-year-old, 4-year-old to be required to wear a mask. And, I have not met one that will wear it for more than a minute at a time. And even then, only if they want to copy somebody that is wearing a mask next to them. And so, we and thinking about the ratios, you're talking about one staff member to 3 children. Our ratios are, 1 to 20 in the big centers and 1 to 6 in the. So, what does physical distance look like in the context that some of our ECD providers work in? Will be a really important thing for the South African ECD sector. I mean, the country as a whole should take interest in this, because we're talking about children of everyone in the country. It would be a very interesting conversation for the whole country to be a part of, and parents.
I would like to add also that actually this about 1 staff to 3 children and to 6 children was this first guidelines that was created, and they has already been revised once, and so now it's a little more flexible. You have to say like 5 to 10 children, and so of course you have to see this in a context. But I think what has been debated and talked a lot about in Norway is that small children will not be affected in the same way like adults have. So you don't have to be that worried about the children. So that is something that there is research about also telling. So it is not that. It's more dangerous with the older pupils in the upper secondary school, for instance.
Of course, even that has been debated. So
Yes.
so much of this is about communication, things changing over time.
Yeah.
Mihaela, any questions?
Yes, I think I will close this session with one more question, and that was very much related with the children with special needs, children with disabilities. As Cecil, you were mentioning that actually the services have not closed at all during this period. That actually they were prioritized among the services. Could you tell us a little bit more how this worked? I mean, how were they able to be kept open? I think there are many others that in countries are experiencing that these services are not functioning anymore, and actually that's it dramatically impacts the families and the children too.
Yes, it was in Norway. The kindergarten was told to give an offer for children with the special educational needs, but it was also an issue because some of these children also had, this health problem that put them in a risk group. So it was also very difficult for the parents. They were also under a pressure, to put their children, which was in a risk group, in the kindergarten or have them at home. That could be very demanding over a long time. So, but I think as the time went by, more and more of these children also come to the kindergarten, and it had to be this dialogue all the way with the parents. So it was quite a job also actually for especially the central leader during this close down to keep in touch with the parents about their needs. And but of course there was staff to be there with them because most children was not there. So they would come to the kindergarten and be there and have their usual training and so in the kindergarten. But of course not everyone used this one, and it was also like not only after a time, it was also we have to look after the children that are not having a good time at home. They might not have special needs, but the family have some needs or don't really cope with having the child at home all the time, and maybe this could be a danger actually to the children. But of course it was like someone said that it's very stigmatizing. I'm not quite sure of the words, but for the children coming to this was also the schools. It was not only the kindergarten. So it was like everyone could see that you have special needs. So this was also a problem.
Grace, was there any special efforts made in South Africa related to children with special needs?
Not that I'm aware of. I have assumed that the children with special needs have basically been attended to depending on their age as part of ECD or as part of schools reopening. I do not remember in the specific education plan that was shared with us, I don't remember a specific mention of children with special needs. And this could very well be an area that requires improvement or special attention in the South African. I'm sorry, I'm not aware of any focus.
I think it's an issue that we all need to pay attention to, and the teachers that work with children with special needs. So, Mihaela.
Yes.
I think that we can move to the next poll that we have planned for you, our colleagues. And again, we would invite you to go to the www.menti.com and answer this time to this question, as we have heard from both countries that surveys were quite useful to get insight from the early childhood workforce view on the measures that are taken or what everything that is actually affecting their own work. We were wondering to what extent, from your knowledge, the measures that have been taken or are planned to be taken have taken into account also the voice of the workforce. So the same platform, we changed the code.
So the question is, did the measures
Regarding the early childhood services took into account the voice of the workforce? From your knowledge, I mean, from different positions that you are having within the early childhood system, broader system, as we are talking about measures that are directly affecting either their professional roles, either their well-being, either their subsistence as a professional. We have heard different perspectives from Norway and South Africa, but obviously in both countries, well, the union has had a survey, as well as Grace was already sharing with us the coalition of organizations that have been interested in learning more about the workforce from the workforce, so that policy measures are taken that are taking into account the views that the workforce facing. Actually, they are the ones who are facing the biggest challenges in interacting with families and children. Well, we can see that in majority of cases of those who have responded, 43 participants, no is the answer.
So it's looking like more than 3/4 of the participants are saying that the voice of the worker has not been included in the measures taken. That's the picture we have to change.
And I think it's essential to be aware of this problem and to find ways in which they are provided with the opportunity to influence the policies through different bodies representing their voice. We have to be proactive in this and look for ways in which we can capture their voices. I know that surveys sometimes can be, and there have been a lot of surveys circulated, but it's equally important that there are forces mobilizing at the local level, at the national level, and trying to capture their biggest concerns. And of course, the way that they are envisaging, even though opening, I mean, the measures that have a strong impact in the way that they are going to function in the services, and they have to have a saying in this at the moment. So I think it's obvious that the answer in the largest majority is no. I think that we can thank the colleagues for expressing their opinion, and we can move forward. And I think it would be interesting to know the same as the union, as you are representing CISL, if you have also the feeling that the voice of the workforce has influenced to a certain degree the way that the measures have been formulated. To what extent do you think that they did play an important role?
I think that we have managed to get, understanding for at least some parts of the guidelines, but of course there is a lot of voices in here, so it's not like it's like if we should have wrote them ourselves. But I think it's a lot of important steps there where they have been listening to us. So this is, I think that is a good thing, and I think it's all over have been a good cooperation, maybe especially this political cooperation between the minister and the union leader. So like even when it was this debate about this guidelines and if it was right to limit the opening hours or not, we could have this dialogue, and we could get the minister to go out publicly and state, this is I agree with the union. This is we have to limit. You cannot expect the kindergarten to have full opening hours and to do these measures that we ask them to do with these small groups and everything. So I think we have this impact, but of course there's a lot of voices, and I think it's all about this economic situation also, it's highlighted a lot. So it's a struggle all the way, to get the voice heard, but I think we have done it. I think we have managed to get our voice through in Norway, and I think that has been very good. Yes.
But I think, Grace, your experience also with what is happening nowadays in terms of influencing the whole thinking around the reopening, it's also a good example that you've managed to come together in collecting the voice of the workforce, isn't it?
So I think so. I think we've had a good start in getting more voices in. I suspect that we still have not been able to get to the farthest people who are disconnected from us by their lack of access to information and data and stuff like that. Many organizations are doing their best to reach them. And I think that on the whole, what we just need to do is to sustain that interaction. As we debate the protocols, it must be in a collective manner. And, as we reflect 3 months from now, it should also be in a collective manner.
Yes. Could I also add that something that we, used to get this impact was also the importance for the staff to feel safe, because, after all these strict measures that was made on a national level, that we were supposed almost not to leave our homes, people were very scared. And, to go to the kindergarten and to do a good pedagogical work and to be a good, good and warm teacher and staff for the children, it's not possible if you are afraid, So you have to feel safe to provide for a good care and pedagogical for the children. So I think that is important.
Same thing like with the families. The families need to feel safe.
Yeah, I was just thinking that, it's an entire discussion actually that is related to the quality of pedagogy in the reopening and how we support professionals from that perspective so that they feel confident that they're doing the right thing. Because I think that there are a lot of concerns around this too. Unfortunately, we might consider this for another webinar since the topic is really quite complex. We're going to move now to our last interaction with you, the audience. And this time we would really want to learn from you. What do you think it's, in your view, what is the biggest concern that you have regarding the early childhood workforce, given that you are either from the different positions that you are representing, either from the different sectors you are working mostly with? And again, we will invite you to go to Mentimeter and share with us. And I will share also with all of you the answers as they are coming in. Yes, I think the mental health being also of the workforce is quite something that is concerning everybody. Unemployment, many of them not having anymore the job, their safety.
Safety and mental health issues, trauma by the teachers, by the parents, by the children.
And job insecurity.
Employment.
Grace, any comments? You look through this?
It's just so interesting looking at the diversity of the concerns, which we all share. Financial concerns, unemployment, safety, mental health, trauma, engagement between the practitioners and children. Very interesting. concerns about being laid off.
Right. And of all these things are, of course, related. So, Mihaela, do you want to make any summative comment on what you're seeing here?
I think I think that those that are kind of popping up as the ones repeating the most is about safety, also job security, mental health, and kind of resuming their professional work with parents, with children. All in all, I think there are aspects that are related to the workforce as human beings themselves, and aspects that are related to their professionalism that it's kind of influenced a lot by the narrative of the COVID. And to a certain extent, we may say that it contradicts with what would mean quality interaction, as it has been defined previously, especially with the very young children, babies and toddlers. It's very hard to keep distance, or what means keeping the distance and not affecting dramatically the attachment that we have taken we have talked so much in, especially for the youngest ones. So it is pretty challenging. I think these were the ones that are kind of coming up as the
clearly. So I want to thank everyone for participating in the poll. It's the beginning of giving you voice around these issues, and want to ask both of our speakers if they have any closing remarks to leave with our participants. And go to you first, Grace.
Yeah, thank you. This has been a really good engagement. Interesting to hear the perspective from Cecil and also from the participants, that we all concerned about the same things, what is really such an important part of the fabric of societies that make economies work, that enable children to thrive, really does not get a lot of attention. I'm talking about the ECCE workforce, about the ECD workforce. It doesn't really get a lot of attention. And so, there's a lot of work to be done, learning from each other, and really making sure that we don't, make the same mistakes that we have made as countries prior to COVID-19. In a way, this is our opportunity. It is disrupting all aspects of our work, and ECD is not immune to it.
Right, it gives us an opportunity. Thank you, Grace, for your inspiration and your leadership. Cecil, any final remarks?
Yes, I want to say thank you so much for organizing this webinar and for putting the early childhood education workforce voice on the agenda. And this is a global crisis that concerns us all. So, I also will thank you, Grace, for your story from South Africa. It really puts things in a perspective, and I know that we are really lucky in Norway, both concerning the finances, but also how this pandemic now are developed in Norway. So, but I think it's so important for us to meet and to share experience, because I think we have to support each other. We have to, not only sit in our own country, because this is a globally problem, and we have to support each other. And I think we also need to do that to put both the children and the staff in the early childhood education at the agenda, and to together safeguard the children and the workforce and the children's right to education. I think this is so. And also, when you were starting to talk about this pedagogical work, Mihaela, I agree with you. We could have another webinar on that one. And then I also want to put attention to, because I also have this close collaboration with my Nordic friends, and from Sweden, they tell about that they have had the kindergartens open all the time during the pandemic, and But of course, there is a lot of measures they have to do also in Sweden. And they have had a survey from the union also out there telling that 75% of the kindergarten teachers are telling that, to fulfill the requirement in the curriculum, in the framework plan, is really difficult right now. So I think also to pay attention to this is very important. So I just want to say thank you to all participants and also for inviting me to this webinar. Thank you so much.
Thank you. And I will also offer my closing remarks. Thank you for your leadership, Sissel, and for sharing that also about what's going on in Sweden. I know here in the U.S., it's varying state by state, and a lot of challenges, both economic and emotional. So many of you have been through crisis in difficult times. I think the one thing that we all hold strong to is our community, our local community, our social networks of support, the community of practice. We have to lean on them. I hope everyone knows you're part of a global movement. We're going to have to be stronger than ever. As millions more are thrown into poverty, budgets are strained, you have to be the voice. So I hope this is a call to action. Take care of yourself. Advocacy, as I always say, takes a long distance runner, so we have to stay healthy. I'll close with this. Like many of you, I've been trying to take walks. I like to take my walks early in the day when the air is fresh. Dawn always comes. You have to take part. Focus on the spirit of young children and the joy that they can bring even in the darkest hour. God bless all.
Thank you, Joan. And I think this is my last intervention, inviting everybody to stay close to our initiative, visit our website, look at the COVID-19 position statement that we developed that talks about 5 priority actions to protect, support, and strengthen. There are countries that already translated and disseminated it in their own countries. As Joan was mentioning, it's the moment for advocacy on behalf of children and families, and especially the most vulnerable ones. And we know that the workforce are the ones that are in close and direct communication and support for them. We are also invited to look at everything that we are producing under our initiative. We have already landscape analysis, country briefs, a knowledge hub with a lot of resources, some of them COVID related. We have had webinars, and we are going to continue having webinars and blogs and news. Soon we will come up with real life stories from the frontline workers, because we trust and believe that they need to be heard. We're going to have blogs that are providing more in-country perspective. There's a lot of space for cross-country learning, because these are times for which we have never been so well prepared, with few exceptions perhaps for countries that have been through hardship. And we are going to continue synthesizing practical resources that are supporting the early childhood workforce across the sector in our knowledge hub. So feel welcome to visit our website. And the last invitation is to sign up for our newsletter. And if there is anything that you would like to share with us about the webinar, but also if you want to engage closely with the initiative, please write to us on my email address. Thank you to all of you. It has been a pleasure to be with you, and I hope that also participants have enjoyed being with us. Till next time.
Thank you very much.
Thank you.
Bye.
Goodbye, everybody.